Welcome to the hip mobility flow. Dixie.
Colleen.
And we're going to start on hands and knees. Bring your right knee behind your right wrist and your ankle towards your left wrist, and then sit your bottom on the ground behind you. Your left leg is going to be out to the side. If you look down at your knees, if you were to draw a straight line from your knee to the front of your hip points, those lines would be straight. So make sure that especially the left knee is back so that it's kind of flush with your hip point. If you look at your knees, both knees will be bent at 90 degrees. If that's too much in your hips, you might bring your front leg, your right leg, back a little bit. You might also sit your right sit bone on a blanket or a block. From here, we're going to sit upright and start to turn your chest towards your left knee. Take your left hand and place your left hand underneath your left sit bone. Just so you know, the left sit bone will not touch the floor, but imagine that you can soften it towards your hand on the floor. And we're going to stay in this position for about a full minute. We've already been there for about 25 seconds. So for the last half, just take a few deep breaths in and out through your nose. And start to notice where you feel sensation in your hip. So we are working this left leg, moving it passively into internal rotation. And from there, go ahead and rotate now towards your right knee. Crawl your hands out in front of your knee and your shin, so straight out in front. Start to hinge from your hips, reaching your belly out over your right thigh. Only going as far as you feel like you can. You may be able to take the elbows all the way down to the ground, but that's for each individual body. Now start to bring awareness back to your left foot. We are going to start to try to lift the left foot off the ground. And you might feel some interesting sensation in the front of your left hip. Just know that that's kind of what we're working with. And then lower and lift. We'll do this 8 to 10 times. And you may feel cramping not only in the front of the hip, but the glute. So just know that that is normal. If you do feel excessive gripping or cramping, go a little slower. Let's do about 3 more. And if your foot doesn't lift like ours, just know we've been doing this for a while, but this is some place to start. On your last one, hold. And then imagine that you could lift that foot off the ground even further, keeping the left knee pushing down into the floor, the left ankle flexed, and the knee bent at 90 degrees. So resist trying to take your foot towards your hip. And hold here for 2 more breaths. And then release the left foot down to the ground. Walk the hands back up. And we're going to start to rotate now over your right thigh. So bring your right hand in line with your right hip, your left hand in line with your knee, and this may be as far as you can go. Start to rotate the chest between the thumbs, and bring your right elbow down if that works for you, and possibly even your left elbow to the ground. Take a few breaths here. Feel the inside of your left knee press down into the ground. And maybe you try lifting your left foot off the ground again. And hold. If you have the foot lifted, go ahead and release it back to the ground. Crawl your hands back up. and rotate towards your front leg. We're going to bring our right elbow down to the ground in line with your right hip. Bring your left hand onto the side of your pelvis, so not your waist, but actually the bone. And we're going to use the hand to monitor how much movement we put in our pelvis. So you want to minimize how much movement. Lift the left knee off the ground and then point the knee towards the sky, tapping the heel in line with your sit bone. Bring it back. So as you go from knee to heel, keep your hand monitoring your hip. And can you minimize how much your hip rocks forward and back? Let's do one more of each. And then bring the knee back down. We're going to now hinge the hip to bring the left knee to stack on top of the right knee. Lift the bottom of your rib cage, so the right side of your rib cage away from the floor. Want great tension in your core, so stability. Keeping the rib cage stacked rather than rolling towards the floor. Lift the left knee off, and you're going to take your knee back, heel back, until your knee is in line with the front of your hip. And we'll do 8 to 10 of these. So kind of moving at your own pace. Again, you can use your hand on your pelvis to monitor how much movement. You want to minimize the movement of the pelvis and just feel the leg bone moving in the hip socket, taking you into flexion, knee coming forward, and extension, knee going back. As you do this, press your right knee and ankle into the ground. We'll do 2 more. And then take the knee all the way back. Keep the knee in line with your hip. Sometimes it helps to take your hand and place it in front of your thigh. And then just bend and straighten the left leg. And you might feel a little something happening in your hamstrings, perhaps a cramp. Just know we are working the hamstrings, and sometimes when we don't work the hamstrings in this way, your body will respond by cramping. Let's do 2 more. Good. Keep the knee bent, and then come back into that position that we were in before. So we are going to bring the knee slightly forward so that the knee rests in the arch of your right foot, which means you'll also have to close up that right knee as well. So there are 2 ways that we can do this. We'll start with the regressed version. So come back down onto your right elbow. Bring your right knee back slightly. Stack your right knee on top of your left. Bring your left hand out in front. Like you're kind of reaching out in front. The chest will slightly start to rotate towards the ground. We're going to lift the hips off of the ground as if you were lifting your right hip up into your top hip. So let's do a few just in this regressed version. As you lift the hips, you'll feel that your chest kind of rotates towards the floor. Good. The progressed version, take your left knee back inside the arch of your right foot. Bring that left hand forward. Chest slightly rotates towards the floor. Come up, and this time lift knee above opposite knee. To come back down, lower the hips. The knee comes back into the arch of the foot. We'll do 3 more of these. And you can continue to stay in that regress version. This is a lot harder than it looks. So if you're having challenges, just go into the regress version. Awesome. Come up onto your right hand. And we're going to swing the left leg around, keeping the right foot inside of your left thigh. We'll take just a little pause to stretch. So hinge forward from your hip joint and stretch your chest towards your foot. You might point and flex your ankle just to give a little floss to the back of the hamstrings. And then sit up. Lean back on your hands. The further back you are, the more regressed it is. The more upright you are, the more challenging this is going to be. So start with just leaning back. Flex your ankle strongly, so toes pointing up towards the sky. Lift the left leg off the ground and lower. And you might feel some cramping in the front of your quad, so the front of your hip. You might think of pulling the leg bone into the hip socket to help activate the deeper hip flexors. And sometimes just a few of these is enough. Good. Bring the left leg back around. So back into that shin box. So the knees are bent deep. You can either bring the hands out in front of you to lift up, or you can use glutes and core to lift up. Swing the right leg back and step the left leg forward. Bring the hands either to your knee or to the floor, so coming into a low lunge. And I'll do this way. And if having your hands on the floor is too low, you can prop your hands up on blocks. Flex your right ankle. Slowly kick your heel towards your hip. Lower, so we're going back into active hamstring. And kick up. Tap down. It's very common to feel cramping in the hamstrings as you're doing this. So you can either take a break or just start to move way slower than you currently are. For the last three, perhaps bring your hand up onto your knee and do it from this position. 1, 2, and we're going to hold the last one. 3. And take deep breaths. You might point and flex your ankle. And in case you're wondering, yes, my hamstring is cramping right now.
Me too.
And then go ahead and bring the toe back down, lean forward, and lift from the back hamstring. Stretch through the heel as if you're going to push it into the floor. And release both hands to the floor and come down onto both knees. Sit your bottom on the ground. Bring your legs wide. And just start to move one knee at a time in without rocking the pelvis side to side. So just notice rotation in your hip. And we will go to the other side. So this time we'll go left leg forward and right leg back. So check knee to hip points, both legs. The tip of your right knee should be in line with your hip, not forward of your hip. Check 90 degrees. And then first, start to turn your chest towards your left knee. A right knee. Right hand underneath your sit bone. Let the sit bone melt towards your right hand. And what I find really interesting is that one side on my body is always completely different than the other side. So just kind of notice as we go through this second side, if you notice a difference, one hip compared to the other hip. Good. Rotate towards your left knee and walk your hands forward right in line with your left shin. You can either walk the hands forward. If you have the flexibility in your right and your front hip, maybe the elbows can come to the ground. Now we're going to start to move the left leg or the right leg, hip, actively into internal rotation. So to do that, start to lift, press the right knee down and lift the right foot off the ground and down. So first we're just mobilizing it, just moving in and out and noticing what shows up. Is there cramping? Where is the cramping? Is it in the front of the hip, the side, the back? Did the same thing happen on the other side, or is it different on this side? And on the next one, we're going to hold it there. And as you hold, you're turning up the volume. So press the right knee hard into the floor and try to crank that right foot up. It may not move at all, but we are actively trying to draw our hip deeper into internal rotation. Take one more deep breath. And go ahead and lower the foot to the ground. Walk your hands up. And we're going to walk our hands out in front of our left thigh now. And maybe this is where you stop. Maybe you're able to bring your left elbow to the ground. Maybe you're able to bring your right elbow to the ground. So rotate your chest to face the floor between your elbows. Move the chest away from the floor. Press the right knee into the ground and maybe lift and hold right foot in that internal hip rotation again. Bring the right foot back down. Crawl the hands back up. We're going to bring our left elbow to the ground in line with your left hip. Check to make sure that your knee is in line with your front hip. I won't get you wrong this time. Out of the corner of my eye, I'm like, that's not. So lift the knee off the ground. Stack it on top of your left knee. Lift your rib cage away from the floor. And then bring that right knee straight back in line with the front of your hip and forward. So I have an interesting thing that happens when I do this. I have some clicking in my sacrum. So that is a cue to me that I really need to engage my core. And if I am able to have that tension all around the front of my core and my low back, I can control that clicking. Next time you take the leg open, stay open, and then bend and straighten. So kicking the heel towards the hip and then straightening. I like to bring my hand, rest it in front of my thigh, because that way I know I'm not moving the knee forward. I'm keeping that hip in extension as I work the hamstring to bend and straighten the knee. Keeping my rib cage and my core on. Awesome. And we're going to bring the heel to the ground so that the knee points up towards the sky. Keep the rib cage away from the floor. Hand on the side of the pelvis. So as you rotate the knee down, so bringing the hip into internal rotation, we're not rocking the pelvis forward or back. And there's a tendency when you turn that knee up to rock the whole body back. Try to keep that hip point, that little bony, sticky out point, facing straight forward. So you're isolating the rotation, both internal and external, just in the hip joint. Maybe two more. My glutes are really on fire on this side. Good. And then bring the right knee to stack on top of the left. Bring the knees back slightly. We might have done it in a different order on this side. Okay. So we'll start with the regressed version. So right hand kind of reaches out in front. Chest slightly shifts towards the floor, so we're not stacked. Not that that's wrong, but that's not what we're doing today. So you're going to lift the left hip up into the right and slightly tilt forward and down. So this is the regressed version. To progress it, come into that shin box or Z-set, 90-90, whatever you want to call it. And as you lift, the right leg is going to hover over the left and then bring the hip to the floor, tap right knee down, and come back up. And we'll do 2 more. And this is really hard. So if you have a hard time, especially on one side, that's something to be very curious about. Good. And we're going to come up, swing the right leg around, face the right foot, fold forward. So taking just a moment to give yourself a little break before we finish up here. Maybe pointing and flexing the ankle. And we're going to sit back for the hip flexors on fire. And remember, the further you are away from your foot, so if it's easy way back here, walk forward, vice versa. If you're too far up, walk back. So find some place where you can lift the leg. So flex the right ankle strongly, feel the quad firm, but think of pulling the leg into the hip socket as you lift. So it's not all quad. And if you're cramping in the quad, that's okay. The medial quad is a hip flexor, but we want to go into those deeper hip flexors. So I like to think of pulling the leg bone into my hip socket without flexing my spine as I lift. Let's do 1 more. Good. And then swing that right leg back behind. You can either crawl the hands out in front and lift yourself up, or you can use glutes and hamstrings to stand yourself up. Left foot swings behind, right foot steps forward. We're going to start hands on the ground, so leaning a little further forward. And we'll do about 6 in this forward position. Kicking left heel towards hip. Moving slowly so that your glutes or your hamstrings don't immediately cramp. Sometimes the fast is what causes the cramp. So move slow. And then for the last few, maybe crawl your hands up onto your knee. And if you're cramping in that lower position, you don't have to lift into the higher position. And we'll do 3 more here. And on the last one, hold. Maybe pointing and flexing the ankle. And notice, same thing. Same on this side or different. Go ahead and let the leg go down. And come down onto the ground again. Take your knees wide, walking your heels back in line with your knees. And check in again. Keeping the sit bones on the ground and rotating 1 knee in at a time. So with practice and consistently, hopefully you'll feel that these become more balanced and that you're able to bring both knees in kind of equally. They may never be equal, but hopefully you at least see improvement. And this concludes our hip mobility sequence.